goal, which is to promote an equitable, patient-focused, and cost-effective health and behavioral healthcare system and healthcare delivery system. That's the big picture of what we try to do with our healthcare-related competitive grants. We give preference to to projects that have a approach that has a sector-wide or systemic approach and often involve multi-agency solutions. And whenever possible, given that there really isn't a huge amount of money when you think of how much we're able to give out for health, and given that health makes up so much of the nation's GDP, and our 9 million is like not even a rounding error when you think of what's needed for healthcare. We try to make sure that we do as much collaboration across some of the other across some of the other areas at the trust, be it in housing, be it in youth development, in workforce, etc. So we have 4 priorities, and the priorities are the bolded bits on the top. One is, and these aren't necessarily in order of importance, these are 4 simultaneous priorities, and we make grants to all of them. One is really looking to advance, using research and advocacy, healthcare reform implementation to ensure that we have strong healthcare and behavioral healthcare system, safety net system in New York, to make sure that there is good coordinated care for those who are either uninsured or underinsured, and to make sure that there is appropriate availability of early intervention, early detection, and strong referral mechanisms for care. The systems, when we talk about systems and health and behavioral healthcare safety net, we recognize that that includes organizations that may not be formally a healthcare serving organization or a healthcare focused organization, because we also recognize, which gets to sort of the next one of the next areas that we focus on, that there are lots of issues that affect health that aren't squarely housed in health, as in a clinic or in a hospital or in a healthcare provider. The second big area is really trying to build the capacity of New York's health, behavioral health, and human service sectors to succeed in a reformed healthcare system. And when we talk about reforms, we are talking about obviously some of the big reforms that happened under the Affordable Care Act, when there was expansion for Medicaid. We talk about reforms that might have come out from some of the Medicaid waivers that we've gotten. We talk about reforms that might come from the way New York State looks at structuring healthcare delivery systems and reimbursement. So it isn't a particular reform, but it's sort of this moving target as healthcare continues to be modified and healthcare systems continue to be modified and adapted. How do we keep up with it? And we try to do this second area around ensuring that there is capacity in New York City's health, behavioral health, and human service sector by having a strong workforce. And we look at programs that can advance professional and paraprofessional workers in the system. We also look at, because increasingly every single sector relies more and more on this information technology, so people and organizations that are serving people can help transition to value-based payments. Value-based payments, again, going back to one of the areas around reform in healthcare that seem to be an issue that, I mean, they've been around for many years, but increasingly there is more and more focus on some of that work. The third area that we focus on, and this gets back to some of the earlier mention in the first slide around where there are things that are not healthcare delivery specific that impact health and healthcare services and the health of our communities and of residents in New York, is to focus on reducing disparities between lower and higher income neighborhoods, with particular investments in disadvantaged communities that really look to some of the social, structural, economic determinants of health, air quality, making sure that there are open spaces, affordable and healthy food, and that there is capacity for people to be as healthy as they can be with access to physical activity, healthy diets, etc. There are probably other areas as well that fall in this bucket of thinking about making sure that neighborhoods are healthy. Violence prevention obviously fits within that. Good transportation is part of that as well, etc. While those aren't named, where there is an overlap with trying to make sure that there is equity and equality in more disadvantaged neighborhoods, we look at those types of projects as well. And then finally, and this is really speaking to the behavioral health component of our work, is we really seek to foster the independence of people with mental illnesses and substance use histories, and looking at efforts that offer both clinical care, but some of the other services and supports that are so critical to recovery and living a healthy life for individuals who may have a behavioral health disorder. And in this case, really, really focusing on, are there participant-led or participant-informed models that then can be sustainable and effective? This work, I would say, is the participant-led and participant-informed. Also is applicable to some of the other areas that we focus on in sort of primary care related work. However, we have called it out in the behavioral health sector because it is still not as well established, well used, and really incorporated into the healthcare delivery systems as much as, say, maybe a community health worker or support groups for people who might be managing other diseases, etc. So just wanted to make that point. So those are our very, very broad guidelines in our behavioral health area. I'll quickly go over our guidelines for biomedical research, and then we'll get to kind of the discussion on, how do we receive proposals, what do we look for when we get a proposal, etc. And we will certainly keep time for Q&A. Our biomedical research grant-making priorities are: we support research for projects that focused in cancer, heart disease, incurable diseases, some other things. Leprosy, we have money for that. We try to focus very much on early career researchers. And while that isn't a formal component of our guidelines, I would say the majority of the work that we do is for people who are starting off in their career and supporting them in that work. Now, there's obviously been a huge shift in the past few weeks with curtailing of NIH and CDC related funding. And while it was difficult for early career researchers to get it before, it's probably doubly so now. We're still going to focus on early career, even though we now know that many, many established researchers are also facing a loss of funding. We do not fund organizations that raise and re-grant biomedical research funds. That's really, really important to know. We try to focus on the researcher directly and the institution that is doing the work. So getting to the proposal review process. The first thing that folks should know is that we accept applications at any time, 24 hours a day, 365 days a year. We have an open application process, and that means you don't need an invitation to submit a proposal or a letter of interest, unless it's otherwise noted that it's an invitation-only type of call. But for our ongoing competitive grants, which is what our health, behavioral health, and biomedical research projects fall under, it is open to proposals all the time. The dates on our website, for those of you who go to our website and have looked, or who have been to our website and have seen it, they are really not deadlines, but they provide a time frame for when applicants can expect to hear back from us. If I'm being very, very honest, what they are sort of gentle pressure for the grant-making staff to make sure that we don't just sit on a proposal when it comes in. we need to get to it and get a decision back, usually within 3 to 4 months, I think is or maybe 5 months from when the proposal has come in. So if it comes in by X date, you will be sure to get a response one way or the other by Y date. The website does provide very, very concrete instructions on how to apply for the competitive grants. I won't go into all of that because you can print that and you can see the process there, but I would recommend you look at it. I'm going to talk a little bit about what happens when you hit the submit button on the grant seeker portal and your project and your proposal lands in our portal. First of all, proposals are assigned every week. So every week, Mark, my colleague who's on the call with me, we go through proposals and we look at them and they're assigned to a grant maker, one of our program directors, to review. Proposals are assigned sometimes just to one program staff member, or again, going back to the idea where we do try to go across sectors and areas that we fund in, to 2 or 3 program directors, and they will collectively work on it. I want to spend a little bit of time just to remind folks about what we don't support, which is also on our website. We don't support grants that go to individuals. We don't support grants for general operating support, for capital and building campaigns, for endowments, for equipment, for deficit financing, or for religious activities. Important to know when you are pulling together a proposal. Within 10 days of submission in the portal, you will likely get an automatic email from us letting you know that either the proposal has been assigned for review or it has been rapidly declined. More often than not, the rapid decline is usually because it does ultimately fall into one of these categories, which we do not end up supporting. Emails are sent to the organization's paid staff head that is identified in the proposal cover sheet. We've heard that these emails often get caught in spam filters. So in the directions, you will note that there is a recommendation to kind of add in the domain so you can then continue to get those emails. Sometimes because they're automatically generated, they are ideal candidates for getting caught in spam filters. As a team, we decide to who the proposal should be assigned to. So particularly where it might be an area where it might fall into two issue areas, housing and food, for instance, we'll figure out which relevant program director should take the lead. It's not something that you as an applicant need to worry about or think, I really want to make sure this gets looked at in this context. Close to maybe 40% of the grants that we make have some overlap between 2 or more areas. You'll be assigned once the you'll be informed once the proposal is assigned. Continuing on the proposal assignment process. Assuming it doesn't get turned down for a rapid decline for one of the reasons that was mentioned on the earlier slide, program staff member will conduct a complete review of the proposal. They'll ascertain whether it's a systemic effort and the proposed project, has a sound approach that meets the need and isn't duplicative of other work that we're already doing. They look to see whether the activities described will address the stated issue and if these will make sense within the context or the field. They look and see the organization's finances and governance and whether the organization has the capacity to carry out the project. And then they will also determine if there are funds at the trust to support the effort. Going back to one of the earlier slides, which talked about how funds, particularly in healthcare, are kind of defined often by a very specific disease, etc. Sometimes we'll get efforts which are really, really important that make a lot of sense, but we just don't have the money that can fit that area. If the project merits further investigation, they will reach out to the organization that submitted the proposal and conduct what we call a site visit. We use the term site visit, But the reality is it can be often a conversation by Zoom or on the telephone. Doesn't necessarily need to be, an in-person meeting. Although if it is an organization that is new to the trust or an organization that has a particular focus on a place and places critical to the work that they're doing, our program directors would like to see folks in person, probably go out and see where you are and see what you're doing, etc. About a third of our grants in any given year are to organizations that are new to the trust, or I would say newish to the trust in that we haven't made a grant to them in about 15 years. So there's often been a fair amount of change at the staff there, at the staff level there. When an organization is new to the trust, we certainly do want to get to know it, and that's more likely than not when we'd want to meet with you in person. We generally only conduct site visits with organizations who we are seriously considering for funding. We recognize your time is valuable. Um, we also have some pressures on our time. And if it isn't a project that is going to move forward, we err on the side of just saying this isn't going to move forward rather than getting either your hopes up or requiring us to also spend time on something that we know just isn't going to really move forward. Just the way that proposals go through a thorough review process, if we choose to decline a proposal, that also goes through a review process internally. So it isn't just a single person who looks at it and says, no, isn't going to work. Again, outside of the caveat on that slide, which talked about general operating support or capital and building, etc. If that's clearly the project, then, it's not going to get a lot of discussion. Capital is capital, and, that's what it is, and that's not going to fit. We build in a pretty long review time for proposals. We make recommendations to our board 5 times a year, February, April, June, October, and December. And grantees are usually notified of the approval the day of the board meeting or a day after that. They'll usually know that they obviously are in the mix for getting a grant ahead of that, but there isn't a long time lag between our board meeting and deciding yes on a proposal and the grantee being informed that they're going to get it. So, now, I want to spend a little bit of time going over what do we look for when we are reviewing a proposal. First area is systemic change. Is there potential for government funding, or is there policy change in the future, or is policy change going to occur in the future? And or are they broad lessons that are easily adaptable for other people who are in the field? I find it helpful to share with grantees and applicants that when we talk about system, we aren't necessarily referring to your organization and your organization system, but really the system or systems within which your organization operates. Healthcare delivery, food provision systems, housing systems, youth development systems, etc. Second, does it affect the sector? Is it something where it is a test or a pilot of an innovative or promising program that can easily be adapted? Is it expansion or replication of a program, either taking on a new population, a new angle or intervention, etc.? Or is it really gathering data in a way to build the proof of a program's value that there is interest at the government level for supporting? I'd say that last point was a lot easier a few months ago. It is obviously far more difficult now as there are significant cuts happening to government funding, but it still is an important area that we think about when we look at a proposal. And third, does the effort include approaches that are accepted as successful? Or does it look to advance the testing of a novel but promising approach? and not only promising in terms of what the work that might end up being carried out or the systems that might be changed, but also promising in terms of having enough capacity to be sustained outside of philanthropy in the long term. I want to spend a couple of seconds talking about the fact that we can and we do support both advocacy and lobbying, which is a little unusual for a foundation. If you've talked to other foundations, folks may support some advocacy, but they often stay very far away from lobbying, which they need to as private foundations. But we can do both. We can do advocacy and we support grants that do advocacy, and we support grants that do lobbying. That's because we also are a 501c3 public charity ourselves. And we take the election that the IRS allows us to do for lobbying, and we use it in the form of our grants and assign it to some of our grant money. We don't do a lot of it. We don't do it often, but sometimes that really is critical. And some of the grant that we are giving can be used for those activities, whether it is both, whether it is grassroots or it is direct. Because of the points I mentioned earlier, systemic change, improving the sector, replicable and adaptable and adoptable efforts, we recognize that advocacy and at times even lobbying are often core to the success of making any of those changes happen. I want to talk a bit about what we don't fund when we get into some of the project reviews. We don't fund a lot of direct service work, to be very, very honest, in the healthcare related area. Some of our other human service areas might support some of it, but in healthcare, we are very much focused on policy, systems reform, healthcare delivery systems. What else do we look at when we're reviewing proposals? We look at issues like grantee capacity and their relevance to an issue. We try to determine if what's being proposed is viable, given the issue, given the environment, and given the organization leading the charge. I want to be clear that this doesn't mean that we only fund safe efforts. Our board is supportive of, and our grant-making staff is keenly aware of the fact that we should take risk, and the fact that foundation support is often the risk capital needed to improve a system, a structure, a policy, or a practice. So we're willing to look at efforts that may have a steep climb, but again, they need to be thought out and put together in a way that it isn't just sort of shooting darts with the hope that something will stick, but with a real targeted effort that will move something forward. So, and because we do support, again, systems change, I'd say when we get a proposal and a proposal that we're interested in, our grant makers, spend some time getting under the hood and kicking the tires a bit in the grant investigation process, just to make sure that we understand exactly what this is. Because when we go to our boards, we want, if there are questions that they have about it, it's not a question of the why are we doing it, but really a question of how are they doing it. So we understood the why bit really critically. They might have questions on how are they going to do whatever they're going to do, and that's why we want to understand the work really well as well. When I talk to grantees or applicants who are interested in applying to the trust, I often say that as a foundation, and those of you who have worked with us before, and I see some names who I know here, that we're the kind of foundation that is probably known for doing a pretty thorough due diligence review during the evaluation part of the project to figure out whether it's something that we can fund or not. But once we make the grant, we kind of try to stay out of your way and just let you do the work. We do require reports, and we do require kind of an update at the end of the grant period, but we are not the kind of foundation that you know needs you to be coming back to us constantly to say, this is what we're doing, this is what we're doing, this is how we're doing it. We kind of put the trust in you that you said the project is important, you've shown you have the capacity to do it, it needs to be done. We're providing you some money to hopefully help move that system or that issue forward. Finally, we do look in our due diligence, thinking about governance and financial structures of organizations and financial capacity. We use the Better Business Bureau as a starting point when we review governance standards. And there are a number of things that we look at when we look at assessing financial health of an organization. We always look to make sure that organizations have an independent board of directors with at least 4 members who are not really, 4 members on the board, and the board members should not be related. We prefer, I'd say probably actually more than prefer, require, with a few exceptions, that there be no more than 1 paid board member. That gets a little tricky when you're working in the art sector, where often the executive director and the artistic director of arts-related nonprofits are both on the board, or sometimes when you're talking to large academic medical institutions where deans may also be on a board along with the institution's president. But for the most part, for community nonprofits, no more than 1 paid board member, which is often then your CEO. We do make grants to organizations that may not be a 501c3. You will need a 501c3 to serve as your, what we call, funds administrator. I think most other people think of it as a fiscal sponsor. And if that is the case, the due diligence around both governance and finances will be applied to the fiscal sponsor. Last bit about what do we look for and around the budgets and project budgets. The budgets that folks submit in their proposal should reflect all of the anticipated costs of carrying out the proposed project, and it should include some overhead or often administrative expenses. We want to see non-staff program costs itemized. For example, expenses relating to carrying out the project, such as consultants, marketing, materials, stipends, travel. In the case of some of the medical research and biomedical research grantees, research equipment, supplies, mice, petri dishes, all that sort of stuff, for the project. It should all be itemized and detailed. While we do not really have a formal policy on the percentage for administrative expenses or overhead, we ask that it be reasonable. And when you break out the non-staff program-related costs as what they are, that usually takes, that usually accounts for a lot of the costs that sometimes people end up putting in overhead generally. We really like to have staff costs, program costs, and then the administrative cost, which then usually ends up being a lower figure. We do have a 5% administrative expense cap for academic medical centers and nonprofit fund administrators to help carry out the work of the grant. Again, it's not the program costs relating to the research, but it really is, the entities that might be managing the grants for very, very large institutions. The budgets should also include, the project budgets should also include what funding has been received or is projected from other sources. If you're putting any in-kind money into the effort, include that and give a dollar value to it. And last but not least, if a cost and an activity, if you wish, relating to a cost, if a project is a project that requires stipends for whatever reason. And there's no mention of how stipends are part of the project in the narrative. Having a line for stipends, we'll question it, but you need to kind of explain everything that's in the project budget as it relates back to what might be in the project description. Now, a couple of questions around do we renew or make multi-year grants? And the short answer is yes, we do, but like almost everything else that we do, there's some texture to it. I want to remind folks that we make grants that are project focused. We look for a specific opportunity, an expansion, replication, etc. We don't just fund ongoing work at an agency. However, we also recognize that some projects may take longer than a year, which is our typical grant period. For that reason, we sometimes do make multi-year grants. It's at the discretion of the program staff and based on available funding. If we do make a multi-year commitment, we take all that money out from our current year budget. I want to say that again because unlike private foundations that can kind of book, what their 5% of spending in grants is going to be down the road in future years, because we don't have that requirement. If we're going to make a grant, our board is very clear that we want to make sure that we have that entire amount available now. So making a multi-year grant, while we do it, it is a process here, and program staff give a lot of thought to it because it means that there will be less money in any given year for other things because we are taking all that money out from the current year, keeping it and allocating it and encumbering it. I had mentioned a little earlier that we don't do a lot of direct service focused grant making in healthcare. If you look on our website, you'll see some projects though that clearly are very direct service focused. And that is usually because, again, going back to one of the very beginning slides where we talked about, I think it was that 1.6 million where it's very focused on a disease or an issue, etc. Sometimes it's a very, very narrowly focused area. And there are not a lot of organizations that are doing that work. If we find a group that's working on it, that's a group that then we'll usually fund for that direct service effort. So for instance, we have a fund that is limited to assisting young, injured, needy classical ballet dancers. That's pretty specific. There's a group that works with ballet dancers, provides the rehabilitation services for them. Makes sense sticking with them because it's a pretty narrow category. I'll close out this section and actually most of the presentation with just a little more note around advocacy and the fact that advocacy often takes much more than a single year, 2 years, 3 years, even 4 or 5 years. And we recognize that advocacy can take time. So we will sometimes support a campaign for quite a while. So in that case, I guess the important thing is there still needs to be incremental movement to the goal, even if, say, the legislation doesn't get passed in the first year. And very rarely does legislation get passed in the very first year of it being introduced. Again, on the state level, primarily, city council is a little different. But we need to see that there has been some measurable movement to it, and the tide is turning to advance that issue forward, whatever the issue may be. And we know that it takes a long time for some of that to happen. So with that, let me, I guess, open it up for questions. I'm going to stop sharing my screen so I can see folks and see if you can either put your question in the chat, or if you want to raise your hand, we'll call on you that way. So whatever is easiest. And I see, sorry, I haven't been paying attention to the chat. I see there is one question here already in the chat. Oh, how much the deadline question and cross-sector projects. Okay, so the time, the lead time, I would say the question is how much ahead should we aim to get in a proposal to get to one of the 5 meetings. I would say usually it is between a low of 3 months to more typically 4 to 5, maybe 6 months by the time we get round to something that comes in now. We are looking at projects now for our October meeting, although I would say much of our October meeting projects are already in, but not all. That's the first bit to your question, Emily. And then your second question was cross-sector projects and how some projects are assigned to program directors. Yes, you can certainly note which areas are going to be targeting and kind of identify what buckets you might think that it fits in. Ultimately, we need to look at what we have and where it fits and so on and so forth. But it's helpful to kind of say that you think this is the angle that you're looking at the issue from is this angle, even though it's multi-angle thing. I have a question from Acro, more about priority monitor through research and advocacy, healthcare reform implementation. That really is, I think, the best way to describe that. Healthcare systems are kind of changing constantly, either driven by funding decisions at the governmental level or improved practices in care delivery. So as we look at that, the work that we do tries to stay abreast of that and make sure that approach is the type of approach, or those things that are part of that approach are what we fund in our work. I don't know if that helps answer some of that. Healthcare reform implementation is obviously a very general term, and because we don't change our guidelines that frequently, the guidelines that I shared were guidelines that were put together in 2015. The iteration before that was in 2005. The iteration before that was sometime in the early 90s. So guidelines usually stick around for about a decade to 15 years. So we use the term healthcare reform sort of broadly to reflect what might be happening at any given point in time in the healthcare sector. Florence, partial amount, a partial amount of the requested budget? Absolutely. In fact, projects that have other funders are often very, very strong projects, because then at that point we know there are more people who have skin in the game. So the project budget should be the overall project budget. And then on the proposal cover sheet is a component that says, is a section that says, how much do you want from us towards this project budget? And Emily's follow-up there around multi-angle projects. Should we select which one is our main focus? I think you should really do what you feel is comfortable for you. I brought that up because very often folks are working across multiple areas, and you get kind of artificially stuck into, well, there's a health funding area, do we just apply for that? I think if you explain what the issue is and how it might overlap with a couple of different areas, that's all we really need. There is no AI algorithm that is going to be reading what you put in and saying, healthcare, more of it. That's where it's going to get shunted to. Joy's question, I would say we try not to have conversations ahead of a proposal being submitted, because quite honestly, nobody calls to pitch a bad idea. The devil is in the details. It's much easier to look at the proposal and then go from there. Our guidelines are broad. You can apply anytime. There are not a lot of hurdles in getting your project in front of people to review it. We prefer that we just get something in writing we'll look at it, and then we can respond. Other questions? I'm seeing if there are any raised hands. Um, uh, Correct, Emily. And Joy, your question, oh, that is an important bit. Sorry, I missed that. Uh, our average grant size is somewhere between 60 to $75,000 a year. There are some projects and areas where it is a little more, others where it can be a little less. But that's the typical grant size across our different areas. Other questions that um, uh, yes, I hope we will be able to share the recording, Joy. My only hesitation is, well, I think actually via a link you can then get to it because it's probably the whatever the MBB KBB is probably huge and it can't really be sent by email. But I think we can figure out a link to have it there where you can then look at it. Sure. And it is pretty much across all areas, the grant amount, Emily. Um, I would say if it is a meaningful and viable partnership, this is to Nancy's question about is there preference for projects with partnerships? And it isn't just a partnership to kind of show that, oh, I think we're doing systemic work. Yeah. Um, Now, you often need to start a partnership somewhere. And so it doesn't need to be something that you've had a long, close association. So you could have found the right partner and now you want to work together. But the context makes a big difference where there is partnership. Sometimes it will make sense for both organizations to get some money to work on things together, separately but together. Other times it might be that a organization is the lead and then others are partnering with them and then might be receiving money in a trickle down manner. Any other? And to Adam's question, yes, through the ongoing application portal, the competitive grants. The competitive grants portal covers all our areas: health, housing, education, civic affairs, animal welfare, environment, arts, youth development, human justice, civic affairs. I think I mentioned that. All the different areas, everything is through the competitive grants unless it is a very, very targeted RFP for a particular issue or area, and then that will be showing again on that homepage of the portal. So there's an RFP up there right now for leprosy research. I think there's an RFP up for arts education, I think. Other questions? Good. I'm glad it was helpful, Emily. Great. Well, if I don't, I'm not seeing any other questions, so everybody gets a whopping 9 minutes back in your busy day. So thank you very much, and we will figure out how to get this to you, probably via a link of some sort. Great. Thanks everyone for joining. Take care.